This Docs on Call is brought to you by Excellus Blue Cross Blue Shield and UHS. I'm here with Dr. Micah Lissy with UHS Orthopedics in Binghamton to talk about knee dislocation. What is a knee dislocation?
That's a good question, because when people say knee dislocation, it could mean a couple different things. I think the most common thing is a patellar dislocation, which means your kneecap actually slid off the top. And that is a much less serious injury, and it's easier to be dealt with non-surgically. But a true knee dislocation means that the bottom bone in your knee comes away from the top bone in your knee. In order to do that, you have to tear at least 2 of the 4 ligaments that surround your knee.
And what causes that?
Typically a high-energy injury. So high-energy injury means you got hit by a car, you were in a horrible car accident, you fell from a building, something like that. But occasionally you can get them from sports participation. When you watch a horrible knee injury from a football game on YouTube, it's likely a knee dislocation.
Pretty big impact.
Big impact.
What are some of the symptoms?
Your knee is bent in a position that doesn't look normal to you, and oftentimes it returns to normal, and so shortly thereafter it might look like it's doing just fine with a lot of swelling, just like anytime you damage ligaments inside your knee, or it could still be out and need to be put back in the emergency room, in which case you're in the emergency room.
Treatment?
So treatments, first and foremost, make sure nothing else is going on with you because it was a horrible injury, and make sure you're nice and stable. And once we're through with that and we can look at your knee a little bit better, we talk about reconstructing or repairing those ligaments as need be, depending on your specific injury.
And the extent of the injury. So,
yeah.
All right. Thank you, Dr. Micah Lissy with UHS. If you want more information, go to our website, WBNG.com. If you want to leave a comment or ask a question, call 584-7362, 584-7-DOC.